We're the Beebout Veterinary Medical Center, and I'm with Dr. Brandon Beebout, and we've been talking about the team that makes Team Beebout. We're talking about the vets today, and you've got a great staff.
We do. Obviously, I mean, we have myself, my wife. We're a pretty good duo. We complement each other so well. I'm obviously very biased in that. Pau is absolutely amazing. She is soft tissue. She's a lot of the preventative. She knows every single side effect drug and every single preventative that we use. I'm kind of more of the ortho, kind of the longer consultation type of stuff, and she can do spays and neuters, and I mean, you blink and you're missing it type of thing. And so we complement each other very well. And then we have Dr. Beck, who's been here since I was a kid here working at Hilltop, you know, and so she's smart, reliable, passionate, ethical, and it's just one of those things that, again, kind of like when we talked to the technicians, it's an interesting characteristics of a very few people. And then, you know, vets aren't around this corner at every stop, and so there's not very many of them around, honestly, and even just in this city, you know, there's not that many people that can help you, and so we have a great camaraderie as far as instead of, oh, you got to go to this, we bounce cases off each other. It's so much fun, and so, you know, you're working on your own thing, and then you get to go over there and help somebody else. And some things that I'm not very good at, I'm going to ask my wife, I'm going to ask Dr. Beck, and vice versa. They get a broken leg, and I'm licking my chops in the office saying, when are they going to come ask me to look at an x-ray and see what I want to do with it? And so it's just great because everybody's good at something, and they get to do that thing. If Pau wanted to do orthopedics, I'd be out of a job the next day. And so we're very grateful to have the team that we have.
And you learned a lot from Dr. Neal. What is your main takeaway?
Client communication. Treating people like family, things that are maybe non-veterinary, you know, and he taught me a ton about veterinary medicine. I mean, I went to vet school, in all honesty, it took me 2 years to learn something because I had so much hands-on experience taking x-rays, looking at blood work, and you know, I showed up and went to work and loved it, and you know, school is one thing where you got to take all these classes and they're not specific into what you want to do, and so working during UNK, getting to apply some of the things that I was learning, and then obviously getting to vet school where it was specific. But he just he not only was he good at business, he was good at people. He was a pretty good veterinarian, you know, and just knew everything. He was a walking textbook, and so I idealized that, and you know, kind of wanted to mirror image that. And there's just something out there that if I don't know it, I want to know it, because you got to be able to access the resources, because 300,000 different things could come in your door at any given moment.
So what advice would Dr. Beebout give the future Dr. Beebouts?
I would say be well-rounded as an individual. You want to be able to, nobody in the room knows what kind of quality medicine you're going to practice. We want to practice quality medicine. We will practice quality medicine, but they're going to know what your bedside manner's like. They're going to know if you're compassionate towards their pet and if you have passion for the job. And again, biased, but that's the only thing I'm good at, you know, and so this fits me perfectly, and I love going to bat for the pets in the Kearney community.
And you do very well with that.
Thank you.
Okay, stay with us. We're going to continue to meet the Team Beebout in next week's edition of Pet Doc.